Have you just been diagnosed with breast cancer? Well, if so, then listen up. The following couple of minutes of education could literally save your life. None of this is medical advice. I'm just some random bloke on the internet. This may be the ramblings of a madman. But let's hear what Professor Seyfried has to say about breast cancer.
And I think a lot of people, when they're diagnosed with cancer, fear the treatments as much as they fear the disease. They don't want to be surgically mutilated. And, there's been big studies on breast cancer showing that the overall survival between lumpectomy and mastectomy is not any different. There's been several big trials on that. And yet they're taken, I spoke to one terrible thing, oncologist, a breast cancer oncologist. Why don't you go do lumpectomy? And rather than do these horrific surgical mutilations. It's easier to remove a breast than do this lump thing. He says it's like filleting a fish, taking someone's breast off. Of all the studies that have been done with radical mastectomy versus lumpectomy, there's no statistical significance in long-term overall survival whether you have a lumpectomy or a radical mastectomy. There's been over and over and over, dozens of experiments have shown this, and yet so many women are surgically mutilated, having their breasts, one or two breasts removed, when there's no evidence to say that's going to give you any longer survival than a lumpectomy. It's unbelievable.
Ask yourself the serious question. Is the oncologist recommending a mastectomy because it's easier for him or because it's better for you? Something to ponder. Now, if you do have a lump, here's what the professor has to say.
Surgery can absolutely cure cancer if you can debulk all of the cancer cells and they're all localized and they haven't spread around. But the situation is the following. Oftentimes, and it's not, let's put it this way, it's not insignificant, biopsies and surgery done at the wrong time inappropriately have the risk of spreading cancer cells around the body. So you say, oh, I got rid of the tumor, and then all of a sudden, 6 months later, you got lesions somewhere else. That came from either the biopsy or a surgical procedure that was done before you put the tumor into a dormant state. The tumor has got kind of an inflamed mass. At least the solid tumors are. Blood cancers also rely on the same two fermentable fuels, but they're in a liquid environment to a large degree, but not to a total degree. But when you have a very angry, inflamed mass, and then you try to go in there and debulk it, or even take a biopsy of it, or whatever you do, you run the risk of spreading things, because the fragments of the tumor will get into the bloodstream, even in tiny, tiny amounts. And those cells then, in time, will have an opportunity to survive. So when I say we have tools, what we like to do, and what we are encouraging oncologists to do, is when the tumor is first detected, whether it's by a PET scan or some image, we like non-invasive imaging, things that you can see that there's some mass there, you don't really know much about it. But why don't you take the patient and put them into a state of metabolic therapeutic ketosis? And what we find is that the inflammation goes down massively. Tumor cells start to die, and the borders, the margins of the tumor become very sharp, and the tumor shrinks. Now, the surgeon would have a much greater opportunity to completely debulk the mass without running the risk of spreading it around. So that's how surgery could be significantly improved.
You'll be much better off if you got yourself into therapeutic ketosis. How do you get into therapeutic ketosis? Well, let's hear what the professor has to say.
Okay, step one, get cleaned up. And by water-only fasting, zero carbohydrate diets, we slowly bring the body back into a new state of metabolic homeostasis. And then at Boston College here, we developed the glucose ketone index calculator, which is a ratio of blood glucose to blood ketones in the blood, circulating level of glucose to ketone. So what we have found, and this is diet irrelevant, what we have found, if a cancer patient can get the ratio down to 2.0 or below, preferably below, the tumor cells start to get hammered, because now you're putting them under incredible metabolic stress. And that will really down-regulate the ability of the tumor cell to survive, but not, they can hang on because they're using some of that glutamine. So you come in with the pulse, and the pulsing now, you use glutamine targeting drugs while the patient is in nutritional ketosis under low glucose conditions. And gradually you start to tear down and break down the tumor. And as I said, also the diabetes goes away, high blood pressure goes away, obesity goes away. All these things go away along with the cancer. So, and that's only because you're bringing your entire back to the body the way it should have been in the first place. And it's very hard to get cancer if your mitochondria remain healthy. We have seen this over and over again. So we're just essentially reconfiguring what metabolic health is, and we use small doses of drugs to target the glutamine. And yeah, we can use IV vitamin C. Once you're in nutritional ketosis, even conventional chemotherapies and radiation therapy will work. You can use much lower doses of chemo and still get a tremendous therapeutic benefit when the body is in therapeutic ketosis.
You can check out our website at metcancer.com. We have a community at metcancer.com/forum. Now do yourselves a favour and go and watch this video.